Now, residents of Niger State are mandated to have a health insurance scheme to access healthcare services in the state, but only 40 residents have enrolled under the Niger State Contributory Health Scheme. TVC News' Chinemi Bamiyi tells us why.
Statistics show that 8 out of 10 Nigerians do not have a health insurance scheme. This is a major hindrance to Nigeria's journey towards universal health coverage. In Niger State, the government established the Niger State Contributory Health Scheme, Niger, to reduce the huge out-of-pocket spending for health services for all residents. The bill establishing the agency and the scheme was passed into law in December 2018 and assented by Governor Bello in January 2019. Making it compulsory for every resident to belong to a health insurance scheme to access healthcare in the state. With the bill, every civil servant in the state and local government employee is expected to contribute 2.5% of his basic salary, while those in the informal sector would make monthly contributions of 600 naira each. The goal of the Niger is to ensure that all residents, especially the poor and vulnerable, have access to health services without any financial barriers. While receiving reports of the performance of the scheme at the State Executive Council meeting, Governor Sani Bello expressed dissatisfaction over the low level of enrollment, blaming it on low sensitization.
In our next meeting, let's get those figures. Number of people that have enrolled, local government by local government, and number of people that have accessed services. And you need to publicize it. You need to publicize it because the health insurance scheme is something new here. And abroad it's almost mandatory for everyone, but here it is new. So I believe when people enjoy the benefits, more and more people will register.
A visit to the Mina General Hospital confirms that most Nigerians are not aware of this scheme or the method of enrollment.
I'm not a part of it, and I've not heard of it, actually. Yes, because I think if there's a contributory scheme like that, there should have been a lot of awareness, especially in the rural areas, because I'm coming all the way from Gidamangoro to this place to access healthcare services. So, and there's a primary healthcare there. You'd expect that people would have known of something like that at that level. Not even here in the town center.
I think it was last year I heard something like that. We thought they are going to implement it, but I'm a state civil servant. We thought they were going to implement it, but up to now, in my place of work, I've not heard anything about it. So we are still waiting and hoping that they will bring it forth.
I'm not here about that. I'm not here about it about now. But you can able to let me know about the healthcare about it so that I can able to put my contribution there.
While they expressed dissatisfaction over how they are attended to at the hospital, they expressed willingness to be a part of the health insurance scheme.
The problem with this hospital, the doctor don't used to come early. We'll be here early in the morning to collect card, but they will not be here early. And gaskiya, the thing is affecting us, gaskiya, because many people are here and some of them have gone because of the doctor are not here.
Why not? If made available, I wouldn't mind. Because of course, health is wealth. And of course, if wealth comes at a cheaper price, I wouldn't mind getting it.
The Niger State Ministry of Health says currently about 40,000 people have enrolled in the scheme, which is less than 10% of the population, a figure they hope to increase with more awareness.
It's a continuous thing. And I want to tell you, Niger is up and down. You can talk today to somebody. Tomorrow, that person will tell you, I've never heard about insurance. That is the behavior of people. Behavior change takes time. We are need to continue.
Governor Bello acknowledges that the whole scheme is relatively new to the people, unlike elsewhere in the world where it is fully operational and even mandatory. He is optimistic that when people begin to enjoy the benefits of the scheme, more people will register.
Right here at the Mina General Hospital, a lot of the patients either do not know about this scheme or have little information about its operation. They say if they are able to access this scheme at the primary healthcare level, they wouldn't have to come here to access medical care facilities. Cheneme Bameyi, TVC News, Mina.